part of my research at UCLA has been focused specifically on stigma related to taking medications. And we've done a lot of interviews with individuals who are now taking Suboxone, which is a medication for treatment of opioid use disorder. And there's a lot of misinformation and misunderstanding about what Suboxone actually does in the brain. And, that the most common misconception being that it's replacing one drug with another and that people are taking it to get high, when if they actually understood what Suboxone does and the way in which it actually stabilizes the brain and makes somebody feel normal, rather
Right.
than high when it's working properly, then they wouldn't hold those beliefs. I wanted to actually read to you a couple of the quotes from some of our research participants about Suboxone and their experience taking Suboxone and the stigma around it. Okay, so in one of our studies, we asked, what do you think other people think about Suboxone? And this one person we spoke to said, pretty much it's just for addicts, and maybe they're too mentally weak to do it on their own. Just mainly it's a negative stigma. And the second person we spoke to, who didn't want to tell his sponsor from the 12-step program that he was working about taking Suboxone, we asked him, why haven't you told your sponsor you're on Suboxone? And he said, he doesn't want me to take that stuff at all. I mean, it's pharmaceutical heroin. That's all it is. And I just wanted to see kind of what thoughts come to mind for you when you hear this, and a little bit about what you and your team at Shatterproof have learned about the impact of stigmatized views around taking medication. What's the impact of that you can see on people accessing treatment? Yeah, anything that you've looked at, because I know that you all have deeply studied stigma and have developed a measure of stigma. So I just wanted to get your take on that.
Absolutely. And just to back up on how we studied it, we worked with one of the largest consulting companies, strategic consulting companies in the world. They worked pro bono for a year and a half for us. And we studied 11 social movements on how to change the public's knowledge, attitudes, and behaviors, and developed a plan to do so for addiction. So we've studied this inside and out. An answer specifically related to Suboxone, those two stories I hear all the time. Suboxone is a partial opioid, but it absolutely works. People don't get high. It significantly works. That was the medication I was referring to related to my son, and it was the best he ever did. And that's why he went 13 months substance free, and he didn't relapse. But they took him off it because they didn't believe in it. He fought relapsing, but I think he was really struggling with it. He told my niece, which I didn't know about, but she talked about at his funeral. She said, I spoke to Brian a month ago, and he said, Jamie, it's like I have this itch in the middle of my head and I can't scratch it. And when I had the Suboxone, the itch went away. It works. And people talk about sometimes, all right, I'll be on Suboxone for 30 days or 60 days. You could be on it your whole life. It's okay. And there's now Sublocade, which is a shot that goes 30 days, which is even better because it keeps it even in your bloodstream for 30 days consistently, all the time, 24 hours a day. It's consistently in your bloodstream in even flow. It works. And what I heard you say is I hear all the time. I can tell you, though, the good news is we've developed a program to educate the public about this. We're operating that program in 5 states right now, representing now 27% of the United States population, because it includes California, which is 13% right there. And in 1 year, we have reduced the stigma against medications by over 10%. In just 1 year. And we just got renewed for another 2 years in California and many of the other states. So we're just going to keep reducing that stigma so people are not ashamed to take it. Doctors are not ashamed to prescribe it, et cetera, et cetera.
I'm curious, who did you survey around their changing views around medication when you say the reduction by 10%, which is incredible? Is that people who are taking it? Is it healthcare providers? Is it all of them?
We surveyed the general public, and I can't remember exactly the sample size. It was several thousand people in the general public. We do it before and we do it after.
That's incredibly powerful, because I'll say that was just 2 examples from 2 research participants. But in my clinical practice, I've seen this a lot as well, that when you have the opportunity to educate a family, a loved one about what a medication like Suboxone really does, and I've seen that medication transform lives, and I've seen people transition from wanting to be on it temporarily to actually saying to themselves, I actually never want to stop taking this. Not everyone
Right.
feels that way, and not everyone should feel that way per se, but once they realize that they actually get their life back when their brain is stabilized, because the brain brain is ultimately, it's altered by chronic substance use. It's not the same brain as it was when somebody started, particularly with opioids, that some brains need a little dose of opioid substitution in order to function normally, to have a job, to have a wife, to have a life.
Absolutely. If you have diabetes, you'll take insulin your whole life. So what?
Exactly.
That's great.
Exactly.
If you're addicted to opioids, take Suboxone or Sublocade your whole life. It's okay. That's great. And you won't need to use substances again. The itch will go away.